The first young infant study was done in several countries in Africa and Asia. This was basically called Young Infant 1 study. It was done from 1990 to 1993. And the objective was to identify signs which could help the people working in the first level facilities to identify children sick enough to be referred to a hospital. But it was quite limited in a way that when the first edition of IMCI was developed, it had 13 symptoms and signs, but the first week of the life was excluded from that IMCI chart booklet. Then people know Abe Bang, who is based in Gadchiroli in India. He did a study in a small village kind of place about 150 kilometers away from Nagpur, where he used community health workers to manage neonatal sepsis because there was no hospital, no doctors, etc. So he trained community people to identify sick young infants and then treat them with oral cotrimoxazole and injection gentamicin. And he showed fantastic results. It was published in Lancet in 1999. And when that was published, there was a lot of pressure in WHO that people are unable to go to the hospital. So how can we best help them in taking care of these young newborns who are very, very sick? And WHO then held a meeting in 2002 to develop a kind of guideline which would help treat these young newborns and young infants when the referral was not possible. And then basically it consisted of two things. One was oral chlorpromazine, and second was injection gentamicin, which could be given at that time. And because it was based on only just one community study, so WHO wanted to do a larger study with many different countries so that we could generalize the results. So in 2004 in Karachi here, we held a workshop in which a protocol was developed to take this one study in the community into a randomized controlled trial which could provide us with better information, better kind of evidence. But unfortunately, although the protocol was developed, nobody was willing to fund it because there were ethical concerns that how could you treat a group of young infants who are hospitalized, one group with injectable antibiotics and one group with oral antibiotic plus injectable antibiotics. So it was not possible. So that didn't really go anywhere in that sense. Then in 2007, there was a consultation which happened in London in which a lot of stakeholders were involved. And there, a discussion took place. There were about 70, 80 different experts from different countries, and they brought data from their countries, which showed the management of these children when referral was not possible. And there was a recommendation that this kind of study or this kind of research could be done in only those newborns or young infants whose families had refused to go to a hospital, so that you don't have an ethical dilemma that you are treating a group in the hospital with one therapy and another group in the hospital with another therapy. So that is how 3 large trials came into being, 2 of them known as SAT trials, one done in Bangladesh, one done in Pakistan, and then 2 trials which were done in Africa known as AfriNest trials. So in between there were several meetings also, because initially when the 2 trials in Bangladesh and Pakistan were developed, they had different methodology, different objectives, and different several things. So WHO reached out to these investigators and also to the stakeholders and the funders that if you support these trials, this will not help WHO make guidelines because they are presenting 2 different things. So there was a lot of effort on bringing them close together so that they had the same objectives, same outcomes, same methods, which were later on also used by the Afrinest trials in Africa, so that when the time came for development of guidelines, we would have good data from several countries in Asia, in Africa, to develop those guidelines, which would not have been possible if 3 different kinds of trials were done in 3 different places. People who are aware of how the guidelines are developed know that you have to collect these data in a certain way so that you can get those effective guidelines which can later on be implemented. In the meantime, there was a lot of other work going on, which included systematic reviews on neonatal sepsis, various issues, epidemiology, pathophysiology, etc. And one of the key persons in leading that with the help of WHO was Professor Anita Zadi, who was one of the head of the departments of pediatrics. Now she is based in the Gates Foundation. So SAT trials were done in Bangladesh between 2009 and 2013, in Pakistan from 2010 to 2013, both published in Lancet Global Health in 2015, and Afrinest trials were done in Africa in 3 countries, DRC, Kenya, and Nigeria, also published in 2015 in Lancets. And then in 2015, WHO developed a guideline on how to manage possible serious bacterial infection when referral was not feasible. So that guideline paved the way of what we will be talking about currently in a little while. But the thing in that guideline was where referral was not feasible. So if the referral was feasible, those children would have to be referred to the hospital. So later on, a little while later, there was a lot of implementation research done in several countries in the world. In India, it started first in Bihar, but then it was also done in 8 other countries in Asia and Africa, looking at how we could implement those WHO guidelines which were for where referral was not feasible. And we also found during that period that there were some newborns who actually didn't need referral. They could be managed on an outpatient basis without referral. And there was also another concern, which was that when you refer a child to the hospital, the guideline was that every child or every newborn or young infant who was sick with these signs of syndromic, signs of PSBI, he should stay in the hospital for injectable therapy for up to 7 days. And there was a lot of concern because people would leave their children with their children after 2 or 3 days when the children got better. And they didn't want to stay in the hospital for 7 days. So that also led to another activity, which was that the WHO, with the help of Gates Foundation, called a meeting in Geneva, where a lot of experts deliberated for several days. And that is how the concept for these 2 randomized controlled trials, for which you will be hearing the results later on, came into being. And one of them would address the issue of whether all the signs of PSBI would need referral to the hospital or some can be treated in the outpatient without referral. And the second element was that whether we could send some newborns and young infants who are sick with PSBI signs after a shorter hospital stay to home, because not every newborn or young infant who was suffering from these signs would have to stay for 7 days in a hospital. In the meantime, WHO also developed operationalizing of these guidelines in the lower settings also. And there was a PSBI Community of Practice launch in which 43 countries are nowadays taking part from low and middle income countries. So the RCT1, which is called we are looking at which of the signs could be treated on an outpatient basis without being referred. And this was done in 6 countries, 7 sites, and you will be hearing more about it. And similarly, the RCT2, these were 2 parallel trials done at the same time, which would show that whether we could send some children home after they got better after 48 hours and switch the therapy from injectable to oral antibiotic, which was a novel idea in a developing country setting, especially in the low resource settings. This has been done in some of the high income settings, the switching of therapy, but very little information is available from the low, middle, and income countries, etc. In 2024, 2 other guidelines came out in December. One guideline was upgrading of the serious bacterial infections, the one which we had developed in 2015, that was updated in 2024. And then another guideline which Yasser led, which was how to manage pneumonia and diarrhea in children who are up to 10 years old. Under 2 months of age, there is also a component of pneumonia. And that component was also covered in this pneumonia guideline, plus the sepsis guideline, which had been approved in December also. So now we are here in 2025. Dissemination of results is happening. We have had 1 meeting in Bangladesh, another in Kanpur, and now we are here in Aachen to share the results with you.